I believe it's NB 1.8.1. It's a variant under monitoring. What do we need to know?
Yeah, so this appears to be a subvariant of JN1, which has been the dominant strain. So it's believed that there is cross-immunity protection. The COVID virus is going to continue to mutate, and it's behaving like a common cold virus. It's now going to become the 5th coronavirus that's seasonal, that causes about 25% of the cases of the common cold.
So you're thinking of it as like a flu-type variant, just a normal fluctuation.
The flu mutates about 34 times more frequently than COVID. The COVID variant mutation rate appears to be a little more stable, but the international bodies that have provided some guidance on which strain to target have suggested that either JN1 or any of these subvariants would be reasonable strains to target.
So you don't seem overly concerned about that. I want to get now into some of the recommendations that have been very specific this week from the CDC and you with the HHS secretary in this video announcement on Tuesday, where Secretary Kennedy said the CDC was removing the COVID vaccine for healthy children and healthy pregnant women from its recommended immunization schedule. He then had a memo to the CDC rescinding recommendations for kids' vaccines, saying the known risks do not outweigh the benefits. Then late Thursday, the CDC said, quote, shared clinical decision making, which I think is just talking to your doctor,
yes,
should determine whether kids get vaccinated. Can you clearly state what the policy is? Because this is confusing.
Yeah, we believe the recommendation should be with the patient and their doctor. So we're going to get away from these blanket recommendations in healthy young Americans because we don't want to see, well, on the COVID vaccine schedule, we don't want to see kids kicked out of school because a 12-year-old girl is not getting her 5th COVID booster shot. We don't see the data there to support a young, healthy child getting a repeat infinite annual COVID vaccine. There's a theory that we should sort of blindly approve the new COVID boosters in young, healthy kids every year in perpetuity, and a young girl born today should get 80 COVID mRNA shots or other COVID shots in her average lifespan. We're saying that's a theory, and we'd like to check in and get some randomized controlled data. It's been about 4 years since the original randomized trials. So we'd like an evidence-based approach. Dr. Prasad and I published this in the New England Journal of Medicine last week, and we're basically saying we'd like to bring some confidence back to the public around this repeat booster strategy theory, because
your statement was not about repeat boosters. It says the vaccine is not recommended for pregnant women. The vaccine is not recommended for healthy children. That's different than annual boosters.
Yeah, at this point, we're dealing, it is a booster strategy. People would be getting the updated shot. So whether or not a young, healthy
kids who haven't gotten
so we'd like
shot?
to see the data. We'd love to see that data
but on a
doesn't
practical
exist.
level, for a parent at home hearing you and trying to make sense
We're
here.
saying take it back to your doctor.
If their child has not been vaccinated, are you recommending that their first encounter with COVID be an actual infection?
We're not going to push the COVID shot in young, healthy kids without any clinical trial data supporting it. That is a decision between a parent and their doctor. And just so, I don't know if you know these statistics, but for 88% of American kids, their parents have said no to the COVID shot last season. So the vast majority of Americans are saying no. Maybe they want to see some clinical data as well. Maybe they have concerns about the safety.
I don't want to crowdsource my health guidance. I want a clear thing, right? You don't go with popularity. You go with, as you're saying, data. And when we look
so
at
let's see the data.
Okay, so the CDC data said 41% of children aged 6 months to 17 years hospitalized with COVID between 2022 and 2024 did not have a known underlying condition. In other words, they looked healthy. And COVID was serious for them.
So first of all, we know the CDC data is contaminated with a lot of false positives from incidental positive COVID tests with routine testing of every kid that walks in the hospital. When I go to the ICU, when I walk to we know that data historically under the Biden administration did not distinguish being sick from COVID or an incidental positive COVID test. When you go to an ICU in America and you ask how many people are in the ICU that are healthy that are sick with COVID, the answer I get again and again is we haven't seen that in a year or years. And so the worst thing you can do in public health is to put out an absolute universal recommendation in young, healthy kids. And the vast majority of Americans are saying, no, we want to see some data. And you say, forget about the data, just get it anyway.
Okay, so